shin box, outer hip stretch. So starting off in a shin box position, so you can start off thinking about a nice big square and then deciding which side you want to do first. So I'm doing an outer shin box or outer hip shin box stretch for my left side, then my left side's going to face out, my right side's going to be in the middle. And what I'm going to do for the outer hip is I'm going to try to turn my chest towards my left knee. So as I turn my chest towards my left knee, something that always helps when you're trying to get into the hips is you can load the sacrum or you can load the hip itself through the legs. It allows the hip to open up a little bit more. So push down to your feet, maybe use your fingertips, lift your hips up off the floor for a second. Then set your hips back down, trying to keep them as even as possible as you square that chest towards that left knee. Then from there, you're going to push down equally through the entire outside of the left leg and as much of the inside of the right leg when we're doing our left side. And then you're going to try to fold over that left knee. Now you want to start off for the outer hip stretch. Usually you're going to start off with the chest more over top of the knee, and then as that hip begins to open up, you can progressively bring that chest closer and closer towards the heel. As long as you're not rotating too much, we want to keep the stretch, in this case, in that outer left hip. So as I'm folding over that spot, I'm thinking about pushing down through the legs, both legs, whatever part of the leg is really on the floor. You want to feel some pressure pushing down as if you're trying to lift up. You want to feel the navel draw in. And in this case, with my left leg is the focus, I'm trying to pull my left hip to the back of my mat. So my left hip is pulling back as my heart and chest is pulling forward. Holding there for that side. Once you've done that left side, coming back up and then switching to the second side and repeating for that second hip.